Good morning, and thank you for joining us for this webinar today. My name is Michelle Woodbury, and I am the Chief Executive Officer with Two Sisters Senior Living Advisors, and I am joined with Emily Rogue, who is a licensed nursing home administrator. She is also a certified senior advisor and a certified dementia practitioner. She is a placement and referral specialist with Two Sisters Senior Living Advisors, and today we are going to talk about how to choose a nursing home in the year 2020. And this is a different presentation than we gave before, and we're going to talk about what has changed and what you need to know about choosing a nursing home. And oh, there we go. Okay. So before we go into what you need to know in order to pick a nursing home, I wanted to show the spectrum of senior care options that are available. Each of these is its own presentation. Independent living, assisted living, and then nursing home care are all different levels of care within the spectrum of senior care, and we are only going to be talking today about the nursing home side. So we will offer webinars in the future about assisted living and independent living, or you can just call us and we can talk about that. And actually, before I get into talking about what nursing homes do and how to go about choosing them, let me let you know a little bit about where we're coming from. Two Sisters Senior Living Advisors is a senior living advisory service. We're in our 9th year of business, and we specialize in helping people understand what level of care is the right one for them. And when is the right time, and what their budget can afford, and all of those things. So this is what we specialize in, and Emily is our nursing home specialist. So we're going to talk a little bit about the function of nursing homes. They primarily serve two functions: short-term rehabilitation and long-term care. And we are going to talk a little bit about, we're going to be mostly focusing on long-term care today, but the process of picking is relatively the same for both. And so going on to the next slide.
I think it's also important to, Michelle, to note that what sets nursing homes apart from some of the other senior living communities in spectrums of care is that they do accept not only private pay, but they do accept insurance for short-term rehab. You know, they'll accept Medicare, among other private insurances like Blue Cross Blue Shield, Aetna, Harvard Pilgrim. And then for long-term care, they do accept Mass Health and Medicaid.
Yeah, I think that in part of the bigger conversation that we usually have is that there are, those two primary functions for nursing homes, short-term rehab and long-term care. But there are really only a couple of reasons why somebody would live in a nursing home long-term. Most people are going to opt to stay at home or move into a different type of senior care community. The reasons why somebody would move into a nursing home primarily are because they need a higher level of care than they can receive anywhere else, either at home or in an assisted living environment, or they can't afford the level of care that they need in any other environment. There are some people that prefer and choose to live in a nursing home environment, but the two primary reasons are that their care needs or their budget dictate that they really need to live in a nursing home. And so what happens a lot is people are surprised by the sudden need to place a loved one in a nursing home. Most people do not plan ahead for or anticipate that the need will be coming, and so that is part of what makes this webinar and our service as valuable as it is. And so what we're going to talk about today is what to know when choosing a nursing home, in 2020, and I have figured out how to navigate the slides, so good. So what has changed in 2020? Prior to 2020, in the years 2019 and earlier, this presentation that we gave and our advice to our clients involved basically 4 steps. The first was to gather data, and that is still a step that we're going to talk more about, but it's not the first step specifically anymore. And when I'm referring to gathering data, I'm talking about overall performance data, really investigating the different nursing homes, staffing ratios, and inspection scores, and all the stuff we're going to talk a little bit more about, and then focusing on what your preferred location is, touring different facilities, asking the right questions, looking for certain things, and then making a decision, which seems relatively straightforward. It's not, but compared to how it is now, it does seem relatively straightforward. And now, in the year 2020, because of COVID, the first step in finding a nursing home is to investigate, is to check availability. There is a lot less availability. We're going to go into that. And so checking availability. The second step is investigating the prevalence of COVID. The third step is to gather that overall performance data. And then the fourth step is to tour if possible. And if it isn't possible to tour, then finding an alternative such as virtual touring. Location isn't even necessarily something that we can consider because of all the other factors, and we're going to get into that a little bit more.
I also think that location is less of an important variable because in COVID times, there have been restrictions placed on visitation in nursing homes. Right. So if you're looking for a rehab, and we'll get into this, I think, a little bit more in this slide, but if you are looking for a rehab, choosing one that's a little further away, that has a better reputation and better outcomes, is the best option, because you're not going to be visiting your loved ones as often anyways because of the visitation restrictions.
Right. Thank you. That's a good point. So availability is a lot more limited than it was before, and availability was limited before. But you still have choices. What happens oftentimes is that somebody is admitted to the hospital, and then they're discharged, and they're given just a couple of choices. Before, it was a list, and now it's just a couple of choices. Emily, I know that you've been taking most of the calls for people that are in that situation. Tell us a little bit about what you're hearing.
Yeah, so I've had, a number of people calling me in this exact situation that you described. There's one that I was speaking to yesterday that sticks out in my head that I can give as an example. So this client, I just started working with them. Their mom was at home, had a fall, ended up in the hospital, and they don't think that home is going to be a sustainable or safe option for the future now for her to go back to. Finances are limited, and she can't afford to pay privately at an assisted living. And the hospital suggested that she was a rehab candidate and could benefit from some rehab, and then the plan would be to transition to long-term care. Well, the hospital only gave them 2 options. One that is far down the Cape, that is a 1-star facility that's a little closer to where they live, but not the best option. And the second was out in the Worcester area, which is a 5-star community, very reputable, and that's the one that they ended up choosing. It's a little further away. So what we did is we put a plan in place to get her rehab at the facility that's a little further away with a good reputation, and then start putting together a plan to get her on the wait list for those communities that are a little bit closer to the family as a long-term goal, and I can help them get there.
Okay, yeah. So if a family member has a loved one in the hospital and they're given just a couple of options, what advice do you have for them to advocate for their loved one if they feel maybe some more options should be on that list?
Yeah, great question. So know that you have a right to advocate for your loved one, and you don't need to accept right away just the few options that you're given. My suggestions would be to talk with a case manager and ask for some options that are a little further out geographically that have a better reputation and start from there. Once the hospital does feel like they've exhausted all options, they may say that you have to pay privately or facilitate a discharge. But you can make phone calls to those facilities that have the great reputation and work with companies like ours to help you understand what those options are.
Okay, yeah, perfect. And we're going to talk a little bit in the next couple of slides about the reputation piece you keep referring to and how you know whether a facility has a good reputation and what it's doing with regard to COVID as well. So that's actually the next thing. So now that you have a couple of options that you know have availability, investigate the prevalence of COVID. So talk to us a little bit about this. Is complicated, and anybody can access these websites, but because of your level of expertise, having been a nursing home administrator, and also because you have a husband that works with data, you've been able to do some things in manipulating the data available within these websites to produce some interesting information. So tell us a little bit about what these websites can do.
Yeah, this is a hot topic for clients that call us. They want to know that the options that they're looking at are safe and that they're not experiencing any COVID outbreaks, or if they are, that they're managed and under control. So I typically will discuss and refer them to two different websites. The first is state level, so local to Massachusetts. The government comes out with a report weekly, which lists all senior living communities, assisted living, nursing homes, and what they're reporting for COVID. And it's very generalized. So they'll say less than 10 cases, over 10 cases, more than 30, but not get into specifics as to if they're with their residents or their staff and exactly how many. If you want the nitty-gritty raw data that is available through the national site, through the Center for Medicare and Medicaid Services, you can log on to their website, which is listed in these slides, and get just that, the raw data. It is kind of difficult to go through and understand exactly what you're looking at without the context to kind of put all the pieces together. But when, with my background and expertise, when I look at the information, I can understand exactly which nursing homes are reporting how many suspected cases of COVID with their residents, confirmed cases, how many cases with their staff, which are reporting issues with staffing related to COVID, which have PPE and which have shortages. All which is very important information when you are looking into options for your loved one to ensure that they're going to a safe facility. So if anybody would like those links and information, they can reach out to us directly or get that from our slides, and I'm happy to go through that with them on a case-by-case basis. I think it's also important when you are talking about a specific facility as a potential option to ask them questions about their infection control protocol. So for example, what happens when one of their residents becomes symptomatic, not yet positive, but symptomatic with COVID? What happens when one of their staff becomes symptomatic? What happens if they can't find staff to support their residents any longer? And what are their visitation policies? Those are all really important questions to ask.
And how do they communicate with the families as well? I know my parents are in a continuing care retirement community, and we get daily emails with updates, even if the update is we don't have any major updates today, which is oftentimes a relief to read, but yeah, ask how they communicate with the family and what is the best way to communicate. Okay, good. Thank you. That is really helpful. And if people want to know more about using and manipulating that data set, please reach out to Emily. So after we have found out about availability and we have learned what their prevalent, whether they've had COVID in the building and what their infection control procedures are, now it's time to take a look at the overall performance data. And I know that when prior to COVID, what we would often focus on here is like the staffing ratios, for example, and other quality of care indicators and inspection scores from their Department of Health survey. Talk a little bit about what in the Medicare.gov Nursing Home Compare website is most critical now to take a look at so that people can really determine how a facility is performing.
Yeah, I'm glad you brought this up. So this is similar to the other sites that we had just discussed. The Nursing Home Compare website is through a government agency, the Center for Medicare and Medicaid Services, and has a rabbit hole of information that you can find out information on nursing homes within a certain mile radius of where you're looking, every nursing home. It will not only state, is it for profit? Is it not for profit? How big is it? Where is it located? But depending on how far you want to go, you could find out, their staffing ratios, quality of care indicators, like which are reporting, pressure sores, or how many have falls, or their antipsychotic use, as well as looking at their actual inspection scores, which happen annually, and seeing, was it more of a clerical error that they got cited for, or was it something, more serious that you can base your decisions off of? There are typically two areas that I focus most of my time on when I just want a very quick snapshot on how a facility is performing. I look at the overall star rating, 1 through 5, 5 being the best, 1 being the not so best. Mm-hmm. And within that, I'll look at the staffing ratio, specifically the CNA hours, certified nursing assistant, and how they compare to the Massachusetts average. The CNA hours are important because if you're talking, this is the person who comes and provides direct care to your loved one. If your loved one is in their room and presses their call light response, a facility that has higher staffing ratios for CNAs could be the difference of them waiting, 5 minutes on average or 15 minutes on average, which makes a really significant difference. The other indicator that I will look at a quick glance, again, is the pressure areas. I think pressure areas is a really good indicator of care because it shows that they're getting to their residents quickly. They're caring for their residents appropriately.
What do you mean by that? If somebody isn't familiar with what you're talking about, what do you mean by pressure area?
Yeah, sure. So I'm not a nurse or a clinician, and I'm just kind of speaking from my background and area of expertise. But when it comes to pressure areas, it's typically a skin breakdown that happens for residents who can't get out of bed on their own. And so because they're in bed or in a chair all the time, they develop these pressure areas, which can be avoided by the staff coming in to either make sure that the skin is clear and clean, or turning them every so often to relieve that pressure. And it is a great indicator to show how involved the staff are and that they have appropriate policies and procedures in place to take care of their residents in a timely manner.
Yeah, I would venture even to say that, pressure sores shouldn't occur. They do, and a good facility is going to make sure that they heal up very quickly. So if a facility has a lot of high incidences of a lot of pressure sores, that tells us that they're not providing care that measures up to what it should be.
Exactly.
Yeah.
Well said.
Okay. I didn't want to overstate, but yeah, I think that's a pretty good indicator at a quick glance. So we're going to look at availability and COVID, gather performance data, and now talk a little bit about visiting and touring, what that's like.
Yeah, so as you all can imagine, touring nursing homes during before 2020 looked very different than what it looks like now. And the reason being is that there are not only internal policies and procedures for each facility that are specific to what's going on there and what their needs are, but also, government regulations in place to protect their residents, which are generally a vulnerable population, against anyone coming in with COVID or anything else. So because of that, when you are looking for a new nursing home for long-term care or rehab, you still want to do your due diligence as you would have before 2020, being able to tour. But now that you're not able to tour, it has complicated things. So some suggestions that I have for my clients who are in this situation are to take advantage of the facility's website. Often they'll have, not only the services that they provide on there, but also pictures of the day-to-day life. A lot of these facilities had started offering virtual tours on their websites, or you can ask the admissions directors for links for the virtual tours since COVID. Schedule a time to speak with the admissions director or any other director at the facility that you want more information on. So you can speak with the rehab director, director of nurses, but make sure that it's a pre-planned meeting so that they have the time to sit down with you and give you your full attention, and that you have pre-planned questions to ask about what sets their facility apart from others and what care your loved one will get related specifically to their diagnosis and how it may differ from their other residents. When you're speaking with the admissions director or anyone else, be aware of the environment and background noises. Are they rushing you off the phone, and do they seem busy, and is there noises and alarms going off in the background? Or are they calm and it's quiet and peaceful, and they're giving you all the time and attention that you need to make this important decision? You can also ask for things like copies of their activity calendar or dining calendar, meal plans to be sent to you so you can review them. And then stay in touch with them. And when restrictions are lifted, go back for an in-person tour, take a look around, have a meal there if you can, or bring your loved one to an activity. Again, no idea when that will be when the restrictions are lifted. Right. Things are changing week by week, but it is trending in a good direction here in Massachusetts.
And Emily, when I coach people when they're touring, whether it's a nursing home or an assisted living, one of the things that I really emphasize people focus on is the staff. I have a philosophy of care over real estate. It doesn't matter as much what the building looks like, so much as how the care is being delivered within the walls of those buildings. Some of the best care are in older buildings that are run down and don't have that new modern feel to them. But cleanliness is definitely something that you can check out while you're in person, and the staff. When we recommend that people tour nursing homes, I always have them look at the staff, and do the staff seem happy at work? Do they make eye contact? Do they smile at you? Happy staff mean they're taking good care of their residents in any capacity, home care or whatever. And so in the absence of being able to physically visit a building, what are some ways that or some questions that a person may be able to ask of a facility to determine if their staff are happy at work, and you know, maybe a little bit about longevity. What are some of the questions there?
Yeah, great question. So I think that longevity, you know, how turnover is an indication that your staff are not happy. So you can ask specifically for your CNAs and nurses, how long have they been working there? How long has the person who's been there the longest been there for? What is your turnover like? Do you use agency staffing? That's a huge one. Agency staff are staff that facilities can hire when they can't find enough staff for their building, right. Meaning these people bounce from one building to another and there's not that consistency. I would also ask if they staff units or neighborhoods consistently with the same staff, or do they move from one unit to another? You want to make sure that your loved one is going to get the same caretakers day in and day out, because they're going to be the ones who notice if there's just a little thing off and report that to the nurse so that they can look into it. I think here is also a good point to mention that the admission procedure in COVID times is different than it was before. So when you're speaking with the admissions director, ask what their procedure is now in current COVID times. When somebody moves in as a new admission, do they have to be quarantined for the first 14 days in their room and need to take all of their meals in there? Do they need to do their rehab in there, or can they go down to the gym? And then what's their visitation policy like? At what point can you come and visit your loved one after they moved in? And will they help facilitate FaceTime calls or those sort of things are questions that you should ask.
Yep, perfect. Thank you. That was a good answer to that question. And as always, we recommend that people understand the options before the need arises. Again, prior to COVID, our recommendation was to be familiar with how the nursing homes in your area are performing, and if you have a loved one who may need nursing home care in the future, to get on the appropriate wait list, because you can always turn down the bed if they call and say, hey, we have something available, but the better performing places do have wait lists, especially now. And so I think the single biggest mistake that people make is waiting until they have a need, or even thinking about it. It's amazing how many people we talk to that are completely caught off guard by the fact that their loved one is now in need of finding a nursing home. Talk a little bit about how much more important it is now because of COVID to have a sense of what's available.
Yeah, so before 2020, the better nursing homes for long-term care have wait lists that are typically anywhere, 4 to 8 months, sometimes even more. So even before COVID, it's really important to understand and identify the better performing nursing homes in your area and get on their wait list before there was a moment of urgency, before you end in the hospital and need to find somewhere to go within a couple hours.
Your sound is not working properly. It's patchy for some reason all of a sudden. But I will summarize. I think what you were just saying is that getting on wait lists and understanding what options and how facilities are performing, even just having a sense of that ahead of time. And then if your loved one does end up needing care, you'll be way ahead of the game. I know that prior to 2020, if somebody was or had an indication of what facilities were performing better, and their loved one ended up in the hospital and they were given the list with what facilities had availability, they would know by looking at that list which ones to look for, and could get their loved one into those facilities for short-term rehab, because it is much easier to get into a nursing home for short-term rehab. The turnover is much, the frequency of turnover is much higher than for long-term care. And so there's ways to get into long-term care by starting with short-term care. And that is probably still true, even though availability is harder to come by. So I'm sorry, Emily, I don't know if you want to try again, but you sounded like you were underwater.
Yeah, no, you covered it perfectly. Can you hear me okay
good.
now?
I can now. I can hear you. Yeah, perfect. Okay.
I think I also was trying to mention that pre-COVID, the better nursing homes have wait lists, you know, of 4 to 8 months. And that's even before all of this. So it's even more important now to know your better performing nursing homes ahead of time.
Yes, perfect. And so now that we've discussed the difference in how to pick a nursing home in 2020, what can we take away from this? The key points are availability is limited, even more so than before. Take time to investigate the prevalence of COVID and understand what their infection control procedures are. Gather overall, you know, even before I move on to number 3, I just want to also mention that I think that in trying times, how an individual organization performs can be very telling. And if a community or a facility is performing well and has risen to this challenge in such challenging times, that's a really good indicator that they're going to be doing a great job no matter what may face them in the future. So now may even be a better time to be looking into how facilities are handling this crisis, because that's a really good indicator. I've always said it's not about whether problems occur, it's about whether and how we handle those problems that defines whether we're happy with it, with a care partner or not. And so, you know, now's a really good time for that. So investigating the prevalence of COVID and how they're handling that. A confident facility, you're going to hear it over the phone and see it in their virtual tour, that they're confident in their infection control procedures. And then move on to gathering the overall performance data, really take a look at the staffing ratios, cross-check that with what Emily was mentioning about gathering data on whether they're short-staffed, if they're having a hard time staffing because of COVID, and if they were running short-staffed to begin with, under normal times, what does that look like? That doesn't necessarily mean you shouldn't choose that facility, but it does mean you should ask questions about it of the people who are managing that facility, and make sure you're comfortable with their answers before you choose that option. The other thing to keep in mind, and I don't think that we've reiterated this quite enough throughout this presentation, is that you may not be able, because of the availability is so limited, you may have to make a choice that you're less than happy with, but you can make a transfer later on at any point, really, when you find a place that does have availability, that has the performance that the indicators that you're looking for. And
right. So moving from one nursing home to another is not, you know, doesn't happen all the time, but it is common practice. So, you know, if you find somewhere where someone can go to keep them safe for now and get them the care they need, you can work on a long-term plan to get them closer to you. And depending on when a bed opens up, that whole process can only take, you know, 1 to 3 days. It can happen pretty quick.
It's quick, yeah, definitely. So thank you for that. And then if you can tour, schedule a tour. If not, ask lots of questions over the phone, see if you can do a virtual tour, look at pictures, and do whatever you can to gather the information about, you know, how their staff is performing during this time. And finally, don't wait till a need arises. We recognize that probably if you're watching this webinar, you're one of the people that are not waiting until the need arises. But if you have friends and neighbors who you suspect might benefit from having some of this information, please pass along our contact information. We're happy to at least point them in the right direction and get them started in an easy way. We hope that this was productive for you and that you enjoyed your time with us. If you have further questions on anything that we talked about, or on independent living, assisted living, home care, or anything else, please feel free to reach out to us. I put our contact information here on the screen, and you can also visit our Facebook page, and we are a A+ rated business on the Better Business Bureau, where you're watching the webinar through right now, so you can find our contact information through there as well. Emily, is there anything you want to add before we wrap up?
No, I think we covered a lot of ground, and anyone who wants to talk through anything specifically, specific facilities or what their options may be, or just what's common practice and what's not, they can certainly reach out to us through our contact information. I do want to say that there are some great options out there and available. There are some really great nursing homes that are currently taking new admissions, new residents. So give us a call. We can help you figure out which ones those are. You may need to look a little harder and a little further out than you would otherwise. But you know, if somebody needs care, they do have options.
I'm really glad that you added that. Thank you. That's a really important point, because I think that it's a really scary decision. It was a scary decision before to have to face placing a loved one in a nursing home, but now knowing that visitation is limited and the choices are even more limited, it is even more daunting than it was, and we're hearing that across the board from all the calls that we're getting, and it is important that people do know that there are nursing homes and assisted living communities and home care companies that are knocking it out of the park right now. So thank you for bringing that up.
Okay, thank you. Great. I'll stop our presentation. Thank you, everyone, for joining us today.